Many things can place hurdles in front of our vocal development. Some of these challenges, such as feeling discouraged or feeling complacent, can be overcome with a little bit of determination and grit. There are some hurdles, however, that can prove to be somewhat more challenging than most. Rheumatoid arthritis is one of those physical conditions that can actually stand in the way of your singing. The good news for many sufferers of rheumatoid arthritis is that it doesn't need to signal the end of your singing journey. Let's find out why.
Sound check. Check 1, check 2.
G'day, my name is Dr. Dan. Welcome back to Voice Essentials, the channel where everybody sings. Now, unfortunately, this statement is more easily applied to some folks than others. For these people who suffer from rheumatoid arthritis, the desire to sing may well be challenged by their physical condition. Now, if you suffer from arthritis, I don't need to tell you how painful the condition can be. But what you may not have accounted for is its impact on your voice, specifically the laryngeal mechanism. When defining the inflammatory condition known as rheumatoid arthritis, Catherine Vertolini writes, "Arthritis is a condition that may affect the joints of the larynx, restricting their mobility. In that case, vocal fold posturing is limited depending on the joints affected." The limitation of the vocal fold posturing is also known as vocal fold hypomobility. Dr. Herman Akshak and Professor Sadeloff suggest that vocal fold hypomobility may manifest with symptoms that range from breathiness, vocal fatigue, and decreased range to aphonia, aspiration, and shortness of breath. Professor Sadeloff, in his text Vocal Health and Pedagogy, further explains that rheumatoid arthritis may produce not only disease of the cricoarytenoid and cricothyroid joints, but also consequent neuropathic muscle atrophy and rheumatoid nodules of the larynx. Rheumatoid arthritis with or without nodules may produce respiratory obstruction. The good news is that less than 30% of people with rheumatoid arthritis present with laryngeal involvement. Of course, this is little comfort to those who fall into the small group whose voice does suffer from the disease. So let's now briefly discuss what can be done to alleviate the symptoms and keep sufferers of rheumatoid arthritis singing.
Sound check.
When treating rheumatoid arthritis, the ultimate goal is to reduce swelling and in doing so reduce associated pain. Now, typically the medical profession will seek to achieve this end with pharmaceuticals known as non-steroidal anti-inflammatory drugs. Your doctor may also combine your treatment using disease-modifying anti-rheumatic drugs and biologics. It is always prudent to discuss the side effects of prescribed medications with your doctor and pharmacist. For example, it's important to note that many non-steroidal anti-inflammatory drugs like Dapro and ibuprofen decrease platelet function during periods of strenuous voicing demands, which can lead to an increased possibility of vocal fold hemorrhage. Massage therapy has also been shown to help those who suffer from rheumatoid arthritis. When seeking massage as a form of intervention for your voice, I highly recommend finding a physiotherapist or osteopath who specialises in the manual therapy of the laryngeal structures. Sufferers of rheumatoid arthritis also often experience flare-ups. These episodes of acute swelling and pain typically necessitate reducing or stopping altogether physical activities that might further aggravate the condition. Of course, this might mean you stop singing for short periods of time, and having worked with some singers over the years with rheumatoid arthritis, anecdotally, these flare-ups can last for a few hours to a few days to a few weeks. My advice, if you are experiencing a flare-up and you know that your larynx is impacted by the disease, then cease singing and wait until the flare-up passes. Now, it's also helpful to learn what triggers your flare-ups. For example, some singers living with the disease learn to limit their vocal practice length and performance loads to ensure that the vocal activity doesn't trigger swelling of the laryngeal joints. Now, trial and error are good teachers if you're able to listen to your body and take note of what your personal triggers might be. Other triggers of rheumatoid arthritis include poor sleep, stress, and infections such as the common cold and flu. Do your best to mitigate all these potential triggers, and you're more likely to be enjoying your singing as opposed to dealing with possible flare-ups. The important takeaway from today's video is those suffering from rheumatoid arthritis can continue to sing. Yes, the disease may warrant an altered approach, but in most cases, it shouldn't stop singing altogether. If you're suffering from rheumatoid arthritis, then I encourage you to be proactive in managing your general symptoms and flare-ups. I hope today's video has been helpful and has encouraged those of you who are living with rheumatoid arthritis. If you've enjoyed today's video, please hit the thumbs up button, and if you haven't already subscribed to the Voice Essentials channel, then allow me to invite you to join our ever-growing community of singers from across the globe who, just like you, want to raise their voice in song. I hope you'll take a moment to check out the channel and subscribe, but for now, I'll sign off. I'm Dr. Dan. Sing well.